E já estamos de volta e vamos dar continuidade à nossa conversa aqui nos estúdios. Vamos agora olhar para o setor da saúde em Angola, que foi também um dos temas abordados durante a conferência de imprensa. Antes de continuarmos a nossa conversa, vamos ouvir a representante da Organização Mundial da Saúde em Angola, que nos fez um resumo do que tem acompanhado no setor da saúde em Angola. So we are back, and before we continue our discussion, we will take a look on the interview with the World Health Organization representative in Angola and listen what she's saying about what she's seeing in Angola in the health sector. E vai acompanhar-nos então a doutora Jamila Cabral, ela que é representante da Organização Mundial da Saúde em Angola.
Na verdade, tenho assistido tanto nesse ano e meio, vi como é que o governo, liderado pelo Presidente da República, por sua excelência, o Presidente da República e pela Comissão Multissectorial, como é que realmente tem demonstrado não só um engajamento muito grande, mas também uma preocupação de rigor, uma preocupação de ter sempre em conta a situação, analisar sempre a situação, ser às vezes um pouco, como é que se diz, um pouco restritivo demais, ou as pessoas acharem que é restritivo, mas na medida do que é necessário para que a pandemia tanto fosse controlada em Angola. Eu realmente tenho estado a exprimir a nossa satisfação em relação a esse rigor que tem caracterizado a gestão da epidemia em Angola. Eu penso que esse rigor, essa necessidade, essa tendência de sempre se basear sobre factos, sobre evidências para tomar as decisões, sempre em avaliação constante, e nós vimos Sua Excelência, Sr. Presidente, na frente disso, mesmo se a Comissão Multissectorial que fazia, digamos, o trabalho, mas o Presidente fez os diferentes decretos, veio à televisão as diferentes vezes para anunciar isso e para mostrar que estava à frente, que era realmente o grande líder desta batalha. Portanto, isso são aspectos fundamentais. Depois, do ponto de vista do sistema de saúde, temos que saber também que, pronto, Angola, de qualquer maneira, melhorou de forma significativa a sua capacidade, por exemplo, laboratorial. Quando começou a pandemia, se não me engano, Angola não tinha capacidade para fazer PCR, ou não tinha uma grande capacidade para fazer exame PCR. Hoje em dia tem em quase todas as províncias, e hoje em dia faz-se milhares de testes por dia. Podemos falar também em termos de capacidade de cuidados intensivos. Foi multiplicado, não sei por quanto. Segundo as informações que eu tenho, tinha cerca de um pouco mais de 200, 300 respiradores no país, hoje tem quase 5.000. Portanto, e as pessoas foram formadas também para isso. Foram criadas equipas de resposta rápida em quase todos os municípios, províncias, e essas equipas de resposta rápida foram fundamentais, principalmente no início da pandemia, para poder fazer o seguimento o rastreio dos contactos, o seguimento dos casos, e poder realmente criar condições para ter as melhores informações sobre a pandemia e poder controlá-la. Portanto, de uma forma geral, eu tenho visto um sistema de saúde e um governo a reagir bem a esta situação, apesar de que como eu digo, estamos numa situação de aprendizado e que, pronto, talvez não haja aquele que reagiu o mais idealmente possível, né? Mas eu penso, dentro desse quadro de reação que era necessária ter e de medidas que eram necessárias ser tomadas, eu penso que Angola saiu-se muito bem,
O que é que ainda falta ser feito, doutora?
Sim, eu penso que realmente eu tenho assistido também a isso, como se diz, um engajamento muito grande e uma vontade de investir na saúde. Penso que hoje em dia, eu costumo dizer, pode ser que essa vontade de investir tanto na saúde mude em alguns tempos. Portanto, temos que aproveitar, porque hoje em dia toda a gente está convencida que devemos investir mais na saúde, mas Angola tem investido mais na saúde, né? Nos últimos anos houve um recrutamento massivo de pessoal de saúde. Acho que, pelos números que eu tenho, houve um aumento de cerca de 35% no número de pessoal de saúde, dos quais uma boa parte são médicos, né? E enfermeiros. Tivemos também quase 100, uma centena, um pouco menos de uma centena de infraestruturas que foram construídas ou renovadas, equipadas, realmente uma subida de nível importante em termos de capacidade para oferecer serviços hospitalares, serviços de segundo nível muito importantes. Portanto, há uma vontade de investir na saúde. Eu penso que isso é muito, muito positivo, apesar de que ainda continuamos sempre a pedir ao governo para mais, né?
Exato.
O governo Angola ainda não atingiu aquilo que foi preconizado pelos presidentes africanos de dedicar pelo menos 15% do seu orçamento de Estado à saúde, mas nós sabemos que há essa vontade política e sabemos que os esforços que têm sido feitos vão sendo feitos para se chegar a esse nível de investimento, mas de qualquer maneira temos tido uma demonstração clara que, havendo os recursos, saúde não é esquecida, né? Também houve muito investimento, como eu já disse, na questão da resposta às emergências, na preparação de resposta às emergências. Penso que Angola está mais preparada neste momento. O que falta fazer, portanto, eu não gosto de dizer o que falta fazer, porque eu penso que vem sendo feito, tudo vem sendo feito. Eu penso que este investimento que tem sido feito agora tem que ser complementado com um investimento também num sistema de cuidados primários de saúde, né? Num sistema de saúde comunitário, que é onde a maioria da população está e é onde se pode resolver a grande maioria dos problemas de saúde da população.
So, Simon, as you saw, the World Health Organization representative in Angola, she's basically saying that Angola is doing a lot better when it comes to the health sector. Your comments on that?
Yes, we all know that health is wealth, right? You know, a healthy country is a wealthy nation. And if you listen to what she said was there's progress being made. She mentioned the effort that the government of Angola has put in place to fight COVID. You know, she came into Angola around 2020, and that was at the height of COVID-19. And right now, let's go through some facts. Angola has roughly 31 million people. So far, about 1,900 people have died of COVID. In the US, we've had more than 1 million people who have died of COVID. So just think about that. The US is most advanced, is an advanced country when it compares to Angola when it comes to healthcare. But right here in the US, more than 1 million people have died of COVID. In Angola, in 3 years, 2020, 2021, 2022, we've had less than 2,000 people who have died of COVID. And so she said she's seen improvement, she's seen the government's response, she's also seen how the government is investing in the health sector. So what Dr. Jamila Cabral said was she's seen progress in Angola, she's seen investment. She said the government is not investing the 15% yet. The World Health Organization encourages government to invest 15% of their budget into the health sector. But she has seen progress. She's talked about political will. She talked about how the government responded to COVID. And I was just noting that even though Angola has roughly 32.7 million, 33 million, less than 2,000 people have died of COVID, when in the US, a more advanced country, we've had more than 1 million people who have died of COVID. Just think about it. So, I think she had a point there, talking about the progress being made.
Yeah, Christy, Angola literally just built more hospitals than ever. What this mean to you?
I think it's great that they build the hospitals, but I also think along with building hospitals, you've got to have so many other components in place. It's not just the hospitals, it's accessibility to the hospitals. The community needs accessibility. It's understanding how to navigate this new system. How do you get healthcare in the system? And it's building infrastructure, building skilled capacity to run the infrastructure and the hospital. President Lorenzo did mention this in his press briefing. He did mention infrastructure. He did mention jobs. He's a guy who likes data and statistics and facts, and so I think he is also on the pulse of that too. That it's not just the hospitals; it's the hospitals and everything that is attached to the hospitals to make it all work. But the hospitals are certainly a major part of overall care of the country, total care, and so. This is definitely a great step. And the fact that he did mention in the press briefing infrastructure and jobs and skilled capacity, that's also great that he's on the pulse of all those other things. And the other thing I want to mention is hospitals are great, but along with the big picture of what these hospitals really mean, communities need to be also looking at preventative care, accessibility to good food, education about nutrition, all of these types of things. So it's a big holistic approach, but the hospitals are a major part of the infrastructure that is going to facilitate all of this. So it's a phenomenal step forward.
Mm-hmm. And do you think that just for the fact that Angola is now investing a lot more on the health sector to improve, of course, the life of the people, this could also send a positive message to the other African countries that in the last years have been investing less on the health sector?
Yes, absolutely. Angola has the potential to be a great model for what other African countries can do, and they have the potential to affect other countries. Maybe Africans from other countries need to come in the future, need to come into Angola for the top healthcare in the region. They can be a real, a stabilizer as far as African healthcare goes. They have the potential to be, a leader in this with these new developments.
Mm-hmm. And Simon, how can the U.S. contribute a little more for Angola to be a giant in terms of health in Africa?
Yeah, if you allow me, can I go back to the question you asked, Christy? So right now, Angola is headed in the right direction. We've had the General Hospital in Cabinda has been built from scratch. We've had the General Hospital for Children in Luanda has been built. We've had the General Hospital in Luanda for Everyone has been renovated. So far, in the past 5 years, we've had almost 85 hospital units built in Angola. We've had like 31 units for primary health care and 54 units for secondary and tertiary health care. And because it's good to have the fact in place and know that because when you judge the government based on where the country was and where the country is. And so you asked, President Lorenzo came to power in 2017. Between 2017 and 2022, how many hospitals have been built? How many have been renovated? And how many are in the process of being renovated? And I just listed the statistics. Roughly 85 hospital units, built or renovated. And right now we still have more hospitals in Luanda in different provinces. They are being built. And that's when I agree with Christy, because it's not just about building hospitals. The reason fewer people die in the US or Japan or other countries is not because of the hospital, it's because of nutrition, sport, and the ability to to do checkups and have access to hospital, have access to good food, and be able to go to the gym and exercise, be able to work. And so I will say that Angola is headed in the right direction when it comes to healthcare, when it comes to not just improving the infrastructure in place, but when it comes to also improving the overall health of the society. And that's why I come back to corruption. Because when we talk about healthcare, we talk about people going to hospital. We talk about when people are sick or women giving birth, but it doesn't start there. People go to hospital because they are sick. And usually people are sick because they've been bitten by mosquito. Malaria is a big problem in Angola. It remains a big problem. And the U.S. government, tying it to your second question, and the U.S. government is already having a partnership with Angola, not just to defeat COVID-19, because the U.S. ship vaccine and all those things, but the U.S. is also partnering with Angola to defeat malaria.
Yeah,
so,
which is one of the main...
Yeah, but if you allow me to land, so it's not just when the person is already sick. It's about what do you do before the person gets sick? What you do, you fight corruption. You recover the money. And that's what the government is doing, recovering the money, fighting corruption, making sure that the oil money that should go to the Angolan people doesn't go into private pocket. Because when that money is recovered, when the country is healthy, and then the overall population will be healthy. And so people will not even need to go to hospital. And one last thing that we say on this, and I believe that the government has to continue in this, direction. Every Angolan needs to have at least 3 meals a day. Angola is a rich country. They are the second oil-producing country in Africa. There are 33 million people. Wealthy country, bright, intelligent. And so every Angolan has to have 3 meals a day. Every Angolan needs to have access to a gym. They need to be able to exercise, have the good life that we have here in the US. And every Angolan needs to have access to, hospital when they need it, not just when they are sick, checkups, being able to do what most Africans do, African leaders. What they do, they don't build hospital in their countries. When they are sick, they just fly to the US because you have top, hospitals here. They fly here, they do checkups, medical checkups, they do everything in the US, and they go back to their country. Yet the people who live in those countries, the people who live in those countries don't have access to the health care that they have, the leaders, have access in the US. And it's not just Angola, we see it across several countries in Africa where the leaders don't build hospital in their own countries and they come to the US to have access to that health care. And Angola is doing something really unique, trying to have those hospital and healthcare hospital unit built right there in Luanda, in Cabinda, in other provinces in Angola.
And of course, Simon, this is going to be changed very soon because with all those hospitals, the people will be better served in terms of health. And talking about health, I also interview a health specialist here in Angola, and he told me about genome sequencing, which is an amazing health technology. No, in the US. Okay. Yeah, he is based in the US. So I want you to take a look on this interview and then we'll come back because this is one of the advanced technology that the United States and many developed countries are using for the benefit of their peoples. And I think Angola right now is investing a lot on the health sector. And this could also be one of the technologies being used in those new hospitals. So let's take a look on the interview and then we'll come back.
So whole genome sequence is pretty much DNA from a blood sample that's collected. And you go to the doctor, you get your sample drawn when you were looking at your cholesterol or your glucose level. So it's a technology that uses that blood sample that you get from that vial, and it's able to read all of the different genes that are associated in your body. So currently your body has approximately 3 billion genes in your entire body. And so this genome sequencing technology is able to scan the blood in about 36 hours. And you're able to see all of the genes that's associated. And then it's also able to predict and determine where there are any type of mutations. So these mutations are what leads to or determines what disease you may be prone to from the chromosomes that you've been given from your parents. So when you look at through a spectrum of looking at, when the genes get sequenced, you'll be able to tell where some of the mutations may occur and be able to treat the individual based on pre-knowledge of these type of mutations in the body.
Wow. Is Angola ready to be part of something like that?
Yes, I think Angola is ready because they have the funding, they have a president that understands that healthcare is essential to the future of their economic growth. And so I think those two combinations, the funding has always been the bigger part of why I think some of the Africa countries have not been progressive. But having a leader that understands that the health of their people is going to be essential to any economic growth that happens in the next 20 to 30 years. And we've seen that with Angola in the last 5 years of the hospitals that they've been building. We just need more. We need more. That's just what the problem is, because Africa is really starting off from behind. But this is a way to accelerate what the healthcare looks like on the continent, because this one technology could help leapfrog Africa into the forefront of medicine. As the second leading oil producer on the continent, I think Angola is well positioned to be a leader in healthcare. I think what we've seen from Angola in the last 5 years is very promising to the future of what healthcare could look like for the entire continent, and them being a leader, especially within this area of whole genome sequencing and sequencing technology and innovation that could really be funded by the large funding that Angola has from the oil producing. I think one of the major areas that Angola could lead in is really taking the next step with creating innovative tech centers that would be able to drive the innovation and build a lot of the innovative centers and healthcare facilities that will be able to do a lot more sequencing, not only for their country, but for the neighboring countries as well, that may not be as wealthy as they are. So I see Angola as a prime leader with taking a lead on healthcare initiatives, as it's done with other areas through government, and it really would send that rippling effect to potentially have other governments on the continent from other countries get involved on this healthcare initiative. So looking forward to how promising that could be. Really want to build the relationship with the Angolan government, Ministry of Health, really emphasize that early detection, early prevention initiatives around infants, children's hospitals that you guys are building really need to focus on a lot of the innovative technology that comes with sequencing. I think that's going to help drive how we even look at treating the elderly patients, because if we're able to look at as much variance as we can doing sequencing, that will help even the continent protect itself from a lot of the other pandemics, like malaria, Ebola. So that's what this technology is going to be able to bring to Angola and to the continent. Looking forward to working with a lot of the Ministry of Health.
Simon, as we saw, the health specialist is mentioned that if the government of Angola continue to invest on the health sector the way that we are investing, Angola could become a good reference and a leader in the continent when it comes to the health sector, right?
Yes. Can I say something about, what Mr. Youssef Enriquez, what he just said? Because what he's saying is that this new technology, which is called genome sequencing, and he explained it so well. It means when you go to the doctor and they ask you for your blood sample, when you give them your blood sample, they can actually analyze it to see every single gene in your blood, and they can predict what type of disease you may have in the next 5, 15, or 20 years. And so it can actually improve the healthcare of people. Right now, what's going on is that people take the samples of African blood and they send it to the US. And so what happened in technology with Facebook and Twitter and LinkedIn, that big data, that big explosion in technology where we have the GPS and Uber and Lyft and everything that we see around, that's what is taking place now in healthcare. That's what is taking place now, but Africans are not paying attention. So the blood samples are taken from Africa. They are sent to the US, and big pharma in the US is doing studies to develop drugs that will be useful to Africans in the next 20 or 30 years.
And we not even benefit from that.
We won't benefit. First of all, we are not investing. So Africans are not even aware.
Angola is now investing.
Angola is one of the few countries. I just listed the 85 hospital unit in research, even employing people, almost thousands of people bringing thousands of people into the healthcare. But how many countries in Africa are investing in healthcare like Angola is doing right now? So I just wanted to say that what he's saying is key. We shouldn't just, we should pay attention to what he's saying, and we should pay attention to genome sequencing technology. And I believe that what Angola needs to do is to embrace this before it's too late. Invest in this new technology.
And we, sorry to cut you off, we have the infrastructures there.
Yes.
This is also like a few steps behind in order for us to have this technology.
Yes, the infrastructure is already there, the people are being trained, and the partnership with experts in the US will be critical, because this infrastructure, the technology started here in the US. And now, I don't know how to explain this to Africans who are watching us. It's not just about treating people. It's a multi-billion-dollar investment. It means that if you can read the blood, all the gene, the billions of genes in a human being, if you can see all of them, you're able to predict what they may suffer from in the next 20 years. And you're able to develop drugs ahead of time. You're able to do what Facebook and LinkedIn and all the rest did in the technology area. And so if you can develop those drugs, you will sell those drugs to Africans. Instead of importing drugs from the US and from China and from India to treat African, when Africans can actually do those studies right there in Africa and treat African. And I believe, I want to say this last thing, I believe that today's topic, discussing healthcare, this is one of the most important topics we've treated here. People are dying. People are sick. People need answers. And so, and when a president understands how important is healthcare and is investing in healthcare, building hospitals, training people, bringing new people into the health sector, that's a step in the right direction. And that's almost like being a visionary for what is needed for Angola.
Christy, as you also saw the interview, he mentioned that the fact that Angola is right now investing a lot on the health sector could lead Angola to be a leader in the continent and a great example for other countries. Do you see the same thing? And I also want you to give us your thoughts on this genome sequencing technology. How could this change lives in Africa if African countries start having this technology available on their hospitals?
Yeah, the fact that we're sitting here today talking about something as complex as genome sequencing, and we are tying that to where the country is going with their healthcare. They're becoming more technologically sophisticated, and that is for a couple of that lends to a couple things: leadership and collaboration. So, it's great that you have President Lourenço looking at something that he may not completely understand. He doesn't have the scientific, he may not have the scientific background, but he knows how to collaborate with the right people to get the information he needs to press forward on these more advanced technological healthcare capabilities that other countries are being afforded. And so it's wonderful to see a president who can take an idea that's so complex and be willing to go into it, be willing to build the infrastructure around it, be willing to work with scientists who may not talk in the same language he talks in, but willing to try to learn and understand so it can benefit his own country. That is definitely a leadership quality. And then, in the interview, Mr. Yusuf mentions collaboration. He mentions, partners, foreign partners, national partners, and I think that is going to be very critical here. and opening the door to partnerships, to growing those partnerships, to continue sharing technologies across borders, and contributing to the overall healthcare. I'm not sure if that answers your question, but you know, I just see those two things here when I hear you talk in the interview, is collaboration in healthcare and leadership are just key.
Exactly. And Chrissy, one of the problems that keep making Africa not develop so fast right now is the fact that many of the governments, they don't invest too much in their people. In Angola, for example, something that is happening right now is that there is not being only investments in the infrastructure, like building hospitals, but also in the human, like more doctors have been trained. And this is also important. And as he mentioned, when we discussed during this interview, he mentioned that even if Angola take this technology, even if the Angola decide to do this partnership and bring the genome sequencing to the hospitals in Angola, that would be key to have doctors or nurses ready to take over. How important it is to also invest in the humans, like, because they are the one performing the work. How important it is to have doctors ready to work and serve the people.
Right. When you're looking at a project like this, these are not two completely isolated and separate parts of this project. You know, one is building and the other's capacity. These need to happen simultaneously. You need, as you build the technology, as you gain the technology, as you build the infrastructure, you need to also be building capacity at the same time. So together, it grows. There's no stagnation there when you're building out a project like this with so many parts that you need skilled workers. Yes. You need education to get those skilled workers on board, and you need really strong collaborative partnerships with the experts who can transfer that knowledge. And so this is fantastic that it seems like the country is on the pulse that these two things need to happen simultaneously, and they need to be built together to be successful. And so it is great to see that more doctors are getting trained, more skilled staff is getting trained to help with these larger projects, these larger healthcare projects. So that is a sign that you're not going to have big, giant, empty hospitals. It's a sign that, you know, you're not going to build this really technologically advanced system that no one ever shows up to run because no one knows how to run it. Everything must happen simultaneously, and it's a huge undertaking and very complex, and it's something that people need to remember cannot happen overnight. When you hear we're building a hospital, we're building a genome sequencing lab, well, why didn't they open it last week? Why didn't they open it, you know, a month later? This is a really big, complex, long-term solution for total health care, for the holistic health care of the nation, because if you don't have a healthy nation, you don't have healthy citizens, how can you have economic growth? How can you have, you know, good trade? How can you have good partnerships? How can you have peace and security and stability? All of these things, the core of all those things is healthcare at the very center. So it is, like Simon says, probably the most important thing in the whole country.
Mm-hmm. And Simon, I want you to emphasize once again how important it is, not only Angola, to invest on the health, but also other African countries. We have seen in many countries in Africa, the hospitals are not well. And most of the rich people, they go out of the country to get treated. But right now, this health specialist is advising Africa should be looking to all those technologies that are available there to serve their countries. I want you to talk to those leaders. Angola is starting and could be example for many other countries in the continent, but what about other African countries? What are they waiting for to start investing more on the health sector? Because a country without health is a country that cannot develop. Don't you?
Yes, exactly. Health is wealth. Health is wealth. Exactly. Now, and I will say the reason they don't build hospitals in their countries is because they fly to the US to get health care. And in Europe. They come to the US, they go to Europe, they have treatment, they send their children, their family members, their wives, their girlfriends, and the second wives, to the US to get the treatment that they need, instead of doing it right there in their countries. So they don't do it. They don't invest. They don't do physical infrastructure. No investment in physical infrastructure. No investment in human infrastructure. No investment in research, in collaboration, in partnership with people like this expert, Yusuf Enriquez, having collaboration with him. No investment, nothing. And so when people get sick, what do? They realize that they don't have the same benefit than the leaders in those countries have. You talk about Angola specifically and why this is important. Let's go back to 2002 when the civil war ended in Angola. Here at the start, 1 million people in Angola died during that civil war. 4.5 million people were internally displaced. Almost 500,000 people fled the country. Right now, the infrastructure was totally dilapidated, destroyed, hospital destroyed. The progress was stopped. There was no progress because people are fighting, people are dying, people are moving away. And right now, because of that, it took Angola longer than other countries to get back to where they should have been had they not been that war. Right now, that's why the government understands that this is a big problem. If our children continue to die, if our women die when they go to hospital, if the mortality rate the maternal mortality rates are still high, we need to do something. And the way we do it is this way. You invest at home, you build hospital at home, you train researchers and doctors and nurses and everyone in the healthcare at home, and then you build partnership with the US and other countries that may have the infrastructures. And so I believe that Angola, when it comes to healthcare, Angola is headed in the right direction. I keep saying that. I don't know about tomorrow, but right now, with the investment I'm seeing, with a president who has been there for 5 years, has built and renovated 85 hospital units. As I mentioned, the General Hospital in Cabinda has been built, the General Hospital for Children in Luanda has been built, and the General Hospital in Luanda for everybody has been renovated. And we have several other hospitals in several provinces. They are being built. And that's why I agree with Christy, because it's not enough to have these beautiful, giant hospitals built when you don't have people trained to run them, when you don't have technology transfer. That means having people like Mr. Yusuf trying to collaborate with them to set up things like advanced technology, genome sequencing, to be able to have the technology that people fly to the US to have, to be able to have it in Luanda, in Cabinda, and in other provinces in Angola.
And that can help also the neighboring countries. Instead of going to, I don't know, Europe or other developed countries, they can start going to a closer country like in Angola when they have all these technologies available to the public.
And it will be cheaper.
Exactly. And Christy, going back to you, what can more Angola do in terms of health? We want, of course, we start already, and we want to do better. We want the people in Angola to have good hospitals and good healthcare service. But what else more?
I think the answer is consistency. Consistency, consistency, consistency across ideas, across collaboration, and across action and words. So making plans is one thing, investing some dollars up to a certain point is another thing, building something and then not running it is another thing. You have to follow through. And so we're seeing the start of a lot of really good things happen with, press freedoms and with these hospitals being built and with, building capacity, skilled capacity to run the infrastructure, and the welcoming of this new health technology genome sequencing. And so these are all really good signs, but these signs need to turn into consistent patterns of historical progress. And that's where you're going to have better relationships in the community, and you're going to have trust. You're going to build trust through action. And that is what's going to be required here to see this thing through and to have the most optimal healthcare and to be that model in the country for healthcare and have people flying into Angola instead of the US or Europe.
Exactly.
It's going to take just consistency, and over time you will build trust and you will attract more collaboration from more partners all over the world who want to be a part of that when they see something going really well. So all this is just laying the groundwork for what has the potential to affect the whole world really, and the region dramatically.
Mm-hmm. And Simon, to close, this is really my final question to you. You are seeing that the WHO representative in Angola, the Jamila Cabral, she said that she have been seeing progress, and she have seen the political will and the really many changes in the health sector, like positive changes. One question that I want to ask you is why we still far to acknowledge all of that is going on in our country. Some of the Angolans, even though you, and I keep going to the international organizations because they are not connected with the government. They are individuals that were sent.
Yeah, they're independent.
Exactly, independent. And every report that they issue about the country is exactly what they are saying. And Dr. Jamila Cabral, she mentioned that Angola is progressing even on the health sector. So why we still, as Angolans, as Africans, sometimes hard or very slow to acknowledge when progress is there?
Yes, I think it has to do with democracy.
Even in democracy, we just discussed.
Yeah, so
we have seen a little steps going
so
on towards
in democracy
the right direction.
in democracy you have opposition,
yes,
and then you
course.
have pro-government, anti-government, and people like us who can be journalists and say, let's table this thing down and let's see what's going on in Angola. And so you will have people who will always see the negative, you have people who sing praises, and then you have people who can be objective. And I believe that the reason why you will still have criticism is because it's not perfect. As I just said, Angola is headed in the right direction, but the work is not done. More hospitals need to be built, more people need to be trained, and Angolan doctors and nurses and those in the health sector needs to earn more money. You need to pay them more. You need to attract Angolan who are in the US. I've seen very bright and smart Angolan people who are in the US and who are ready to go back to their country if the environment is conducive, if you can pay them well, if they can be in a conducive environment, if they can have access to basic amenities. If you don't have all those things, people are not going to return to a country where they don't have peace and security, where they don't have electricity, where they don't have water. And I believe that what the government is doing now is to put in place some of this human and physical infrastructure so that they can begin to develop Angola from Angola and then attract resources and attract people and attract investment, attract collaboration from all around the world. But it will take time for people in the country who may still be suffering to see the progress that is being made. And this is the final thing that we say on this. Angola is a rich country, the second oil-producing country in Africa. Angola needs to have every Angolan needs to have 3 good meals a day. Every Angolan needs to have access to a gym.
We are becoming the
Angolan
first
needs to have, yeah, I think you have become the oil.
In the continent.
Yeah. So every Angolan needs to have access to the good things of life. They are not yet there. They need to complain. They need to keep pushing the government. And I'm not saying that the government is perfect. I'm not saying that everything has been done in Angola and it has become an El Dorado. that President Juan Lorenzo came and he has turned Angola into mini Dubai. No. Or maybe Las Vegas, or maybe California, or I don't know, any other country or places or place. But I'm saying that you can see the political will. You can see investment being made in healthcare to improve infrastructure, to train people, train doctors, train nurses. And that's the main thing. When I judge a government, when I judge someone, I don't judge people for their perfection. No one is perfect. You are not perfect, Hariana. Christy is not perfect. I'm not perfect, and we don't claim to be perfect. But what people look at is, are you making progress? Are you investing in key critical infrastructure areas to develop the country, or are you just stealing the money? You know, Angola is becoming, as you said, the #1 oil-producing country in Africa. You make hundreds of millions of dollars every day, but are you using that money to improve the lives of the Angolan people, or are you using it to steal? And from what I'm seeing now, the money seems to be going in the right places. For now, I don't know tomorrow. You may invite me to this program one day, and I'm seeing that the money is being stolen. Nothing is going to infrastructure. People are hungry. You are not investing in anything. And when you invite me, I will come to this studio and say that the country is headed in the wrong direction. But right now, it is headed in the right direction.
Of course, this is, for now, this is not the case of Angola. Of course, we are walking towards the development of the country, and many of the Angolan resources have been invested in the right areas, and health is one of them. Mm-hmm. So thank you, Simon, for this amazing discussion. We will be back, of course, next time. Christy, it was a pleasure to have you. I hope to see you next time.
Absolutely. Thank you.
Thank you. Thank you, Simon.
Thank you for having me.
Mm-hmm. So let's now listen to the Angolan community residing in US. Let's take a look.
O meu nome é Jéssica Souza, vivo em Houston há 5 anos e sou uma engenheira de perfuração. Angola surpreendeu-me de forma negativa porque depois de tantas promessas e expectativas ao combate à corrupção, deixou muito a desejar. Contudo, temos que parabenizar o nosso governo pelo combate ao Covid, o que acabou por salvar milhares de angolanos. Nós somos 30 milhões de angolanos, tenho a certeza que um de nós irá mudar Angola. De Sabizanga ao Miramar, de Cabinda ao Cunene, mulheres, homens, idosos, jovens, fazemos todos parte do povo angolano e temos um contributo a fazer.
Eu sou Emmanuel William Soito, estou cá em Houston há 12 anos, formei-me em arquitetura, fiz o Bachelor em arquitetura e o Master em arquitetura. Sobre o futuro de Angola, eu acho que ainda temos um percurso muito longo para percorrer. É necessário que os nossos servidores públicos sejam fiéis à confiança que lhes foi atribuída pelo povo soberano. Em suma, precisamos de um governo que consiga criar políticas que tornem a administração pública eficiente, uma Constituição consensual que promova a justiça, a educação, a inclusão, valorizando a família como o núcleo principal da sociedade.
Chamo-me Bruna Sequeira, vivo em Houston há 4 anos e sou formada em contabilidade. Sobre o futuro de Angola, Angola tem um futuro próspero, mas é um futuro que precisa da ajuda do povo e ajuda de um governo que acredite no povo e que também atenda às necessidades do povo. Angola tem uma cultura linda, Angola tem o turismo e, para além disso, Angola ainda tem jovens com mentes brilhantes, à espera de oportunidades. Devemos apostar nas nossas instituições hospitalares, nos nossos médicos, nas nossas instituições escolares, nos nossos professores. Devemos também investir nos jovens que têm muito para oferecer. Angola precisa de nós e precisa de nós juntos.
E foram assim os comentários dos angolanos residentes aqui nos Estados Unidos. Obviamente, na próxima edição do nosso programa, nós vamos ter mais angolanos e vamos ter outros temas para discutir com os meus convidados. Eu espero que você em casa tenha gostado do nosso programa. Nós vamos voltar no próximo mês com mais um programa, mais assuntos para discutir e, obviamente, vem aí o tema das eleições e vocês não podem perder. Muito obrigada pela vossa audiência. Nós vamos voltar na próxima edição. Até lá!